Now at 4, your community focus, we're talking COVID-19 today with Dr. Jim McDonald from the Rhode Island Department of Health.
He joins us every week right here on 12 News Now at 4. Dr. M, thanks so much for being with us.
Oh, thanks for having me. Another happy Thursday to you. Great to be here.
It absolutely is. You know, as we have been reporting, Massachusetts is now essentially allowing caregivers to get the shot at the same time as someone they're taking care of right now at these large state-run vaccination sites. Can our supply chain in Rhode Island handle something like that?
Yeah, I think that might happen a little bit later in our implementation. Right now, the focus is really 75 and older, and then soon thereafter, 65 and older. You know, keep in mind, we really want to minimize mortality and people ending up in the hospital, so we have to focus on those strategies first right now.
In our first half an hour here at 4 today, we heard a little bit about fears of the vaccine. We actually heard that 1 in 3 Americans in this survey say they definitely or probably will not get vaccinated, and they have concerns about side effects and trusting the government. What's your take when you hear numbers about that, when there is such a push to get this out to people?
Yeah, it's interesting. That's people being honest, and honesty is always welcome. And one of the things I think people need to do is when you're worried about things like this, talk to your doctor about it and ask them what they're doing. I can tell you what your doctor's doing. Your doctor's getting the vaccine. And I think this gets to, though, just other issues like, look, we've been going through a population trauma. This whole year has been a hard year for everybody. You know, the pandemic causes pain to all of us every single day. We just have to say that's something we live with. But we have to get back to what's real, which is that, look, it's going to come to a close. Talk to people you trust and respect, and then make a decision that makes sense for you. You know, and I think getting the vaccine is the decision that makes the most sense for everybody.
Dr. M, we've been hearing a lot about these new variants. A little bit earlier in the show, we heard from Dr. Ashish Jha. Dr. Alexander Scott today said although the new variants have not yet been identified here in Rhode Island, they likely are already here, and it's only a matter of time before they become the predominant strain. So what should folks know about these new variants, and what might life look like if they do become the predominant strain?
Yeah, Kim, it's funny. You remind me when Paul Revere did the midnight ride. He was walking around, look, 1 if by land, 2 if by sea. The British are coming, right? So don't expect Dr. McDonald to be riding a horse through Providence saying the variant is coming, the variant is coming. But guess what? The variant is coming. We know it's going to be here. So what people need to do is look at how do you prevent yourself from getting the variant. And just so you know, one thing that's really true about every virus, a lot of viruses mutate. Best way to stop a virus from mutating, don't let it replicate. So don't get the illness, right? So I got options for you, right? Cloth masks, they're okay. Look, my neighbor gave me a Dr. Fauci mask, right? But in the news, we're talking about double masking. What is double masking? You take a medical procedure mask, put it behind your cloth mask. You don't have to have a Dr. Fauci mask. I just happen to have one here. Put them together, put them both on your face, and it works great. But if you don't want a double mask and you want to get another type of mask, another approach, which I think is a really good approach, this is what I do, is I use high-quality masks. So I have here KN94s or KN95s. The KF94 comes from Korea, the KN95 comes from China, but they really put a nice seal. You can feel the seal on your skin, and it provides you great protection. And so, you know, I get these from major online retailers. I think everybody knows what I'm talking about here. They're very affordable, and these work great, and they're comfortable. Mine lasts me weeks, and I think this is something that people need to look at. It's like, upgrade your mask, because we need to go about town and do our lives.
Yeah, Dr. M, I wanted to ask you specifically about double masking or wearing a sturdier mask like the KN95. Is the goal here still to protect others? Because that was the message that we got when we were first told to put on a face mask. You're doing it to protect other people. Or is the goal now really to protect ourselves?
Yes, it's about protecting ourselves at this point. And this is part of why I wear one of these high-quality masks when I'm out in public. I definitely don't want anybody to have a problem for me, so I really care about others. But guess what? If I'm out in town, I want to protect myself as well. So these things offer really good protection. Keep in mind, although these aren't medical grade, they're really similar to what we use in the hospital. These are great protection devices, and it really allows you to have a lot more comfort, especially if you have someone in your home who's got COVID. Either double mask or use a high-quality mask. Do some things that make sense to afford you some protection. So if someone's got COVID in your home, having everybody double mask or wear high-quality mask really affords great protection for everybody.
Dr. McDonald, as always, we appreciate your time at 4 o'clock. Thanks so much for joining us today.
Thank you. You guys have a great day.